Well, hello and welcome to today's session on advanced care planning for healthcare. My name is Kat Laws. I work for the UC Health Aspen Club as a community health educator. The Aspen Club is a health and wellness program for those age 50 and forward throughout northern Colorado, and we provide a variety of health education and services, one of those being advanced care planning. I'm honored to be with you all today, and I just want to applaud you all for your engagement with the CSU Death and Dying class. I just think that this is a topic that needs more normalization, and the more conversations and education that we can provide on this topic, the better. With that, please know you have my contact email and phone number if you would like to connect after this, and please let me know if there's any questions you have, or if you would like to start your plan for peace of mind and having advanced directives in the future. Our agenda for today's session is to quickly discuss the overview for advanced care planning, what this process is about, the importance of planning ahead and having robust conversations with our loved ones, different types of advanced directive documents and how to complete them properly for the state of Colorado. We will also dive into organ and body donation, as well as CPR directives and most forms. With that, let's jump right in. I like this quote. I have an advanced directive not because I have a serious illness, but because I have a family. Now, family may take a variety of forms these days, but I think we can all agree that we all have loved ones who would benefit greatly from knowing what matters to us and what we would expect during a medical crisis when we could not speak for ourselves. So this can be a great gift to give our loved ones. No matter what family might look like for you, having an advanced directive is truly important for those age 18 and older. So I hope you'll consider doing this for yourself and sharing what you've learned today with your loved ones. So what is advanced care planning? I like to think of it as the overall process of learning for yourself what matters to you and what's important to document, and making those preferences known to our loved ones and medical professionals through both discussion and documentation. So this process is one that may change over time and is worth repeating, and we'll talk about when that's important to do later on. And what are advanced directives? These are the documents by which we make what matters known. They are legally binding documents that you do ahead of time to state your preferences for medical treatment at a time when you cannot speak for yourself medically. So we like to call them advance because we are doing them well ahead of needing them. I always like to say it's always too early until it's too late, and it's much better to have these conversations around the kitchen table opposed to the ICU bed. So who's this for? Everyone age 18 and older at any stage of health is encouraged to do this advanced care planning and to complete advanced directive documents. To get us thinking more about this process and to encourage you to get started with discussing this topic, I have a short video. However, it's not going to play for us at this time. So I encourage you to use the Vimeo link that's included in this slide and should be shared with you as one of the resources for this information from your class. This is just a great video with a variety of different perspectives on advanced care planning, and it gives a really good start to this conversation and this topic. So I encourage you to watch that at another time. One of the wonderful planning tools that we have available to us is the Conversation Project Starter Kit. The Conversation Project is a nonprofit group who is leading the charge in helping people have more robust conversations. Their website is filled with helpful guides to help you reflect with yourself about what matters to you and then be able to share what you have come up with your loved ones. I think this is a great place for anyone to get started with the advanced care planning process because, as we know, reflecting with ourselves about what matters is what will inform any documents that we put together. So the Conversation Starter Kit does come in a condensed version that is pictured at the bottom of this slide and would be a very short, great place to start. There are many varieties of kits available through the conversationproject.org, and they are available in a variety of languages, and they also have a great video library if you are wanting to learn more about stories and how people are engaging with this wonderful project. So know that this is a tool that is available to you, and there's much more available through their website. So the advanced directive documents that we would like to discuss together will include the medical durable power of attorney, the advanced directives for surgical medical treatment, also known as the living will. We will briefly discuss 5 wishes, declaration of disposition of last remains, and the donor registry. There are also 2 related physician order documents that I'd like you all to know about, including the CPR directive and the MOST form. You'll notice here the MDPOA is bolded and listed first on this list of documents. That is the number 1 most important form for everyone age 18 and older to have. This form is fairly simple to do. It does not require witnesses or notary, and it's what you can do to have a say in who can speak on your behalf if you cannot speak for yourself. So let's talk more about the Medical Durable Power of Attorney, MDPOA form. This form is great for everyone age 18 and older to do, and it's especially important for those living in Colorado because there is no default as to who can act on your behalf in the state of Colorado. Once you turn 18, you are legally an adult, and the law in Colorado does not have anyone as a default decision maker for adults. And if there is no medical durable power of attorney form done, then it moves to a medical proxy process. So if you have not identified a healthcare agent through medical durable power of attorney, there's no one determined as a decision maker for you, and you are unable to speak for yourself, the hospital will gather all interested parties. That could be parents, spouse, adult children, anyone, neighbors, friends, anyone who is interested in your care. Once those people are gathered, it is up to that group of people to determine a temporary decision maker, also known as a medical proxy. That's a term for Colorado. And that proxy person will make all medical decisions needed for the duration of that illness or injury. If that group of people cannot determine a proxy decision maker, it moves on to a guardianship battle within the court system. So you can see where having this single piece of paper could really make a difference for folks. And all of that battle can be avoided by having this document in place. So this form designates who can make medical decisions if you are unable to make them for yourself. This person is known as your healthcare agent. And this healthcare agent is able to make every medical decision that you would otherwise. They are able to discuss with your physicians, view your medical records, and make decisions related to your care. That could also mean where you receive your care and how long care is provided. You can change your healthcare agent at any time by completing a new document. So if something changes with your relationship, or you need to involve more people, less people, then you can do that by filling out a new document, which automatically replaces any other documents you've done in the past. And this form does not require witnesses or notary to be valid within Colorado, though we suggest doing both, having 2 witnesses and notarization to make this document most portable, to give it the best shot of being respected no matter where you go. So in addition to a medical durable power of attorney form, many people choose to complete a living will. That is the advance directive for medical surgical treatment. This form is only looked at after all life-saving procedures are provided, and it has become clear that no matter what treatment is provided, the patient is passing away. There is no hope of returning this patient to functioning on their own without mechanical means. So this document is only looked at after 2 physicians determine that a patient is in an irreversible situation for which life-sustaining procedures will no longer be able to return someone to functioning on their own. And this patient is either in a terminal condition or in a persistent vegetative state, for which these measures will only be given to prolong the moment of passing. So this becomes instructions for artificial nutrition and hydration, as well as life-sustaining procedures, including intubation. Life-sustaining procedures could include blood transfusions, major surgery, dialysis, things that are maybe being given as a bridge to help someone return to functioning on their own, but those procedures are no longer functioning to do that. And this form only goes into effect 48 hours after 2 medical doctors certify that this patient is in a terminal end-of-life situation. Those 2 doctors, one will be an attending physician and the other will be an outside opinion. And to be valid within Colorado, this form does require 2 witnesses, and if one travels quite a bit out of state, then both witnesses and notary are encouraged. So this form can be done on its own or in combination with the medical durable power of attorney form. And it can be standalone instructions for an end-of-life irreversible situation that one may face, or can act as instructions to your healthcare agent identified through the MDPOA and to medical professionals as to what you would want. I think it helps to have both a medical durable power of attorney and living will so that it is clear what your choices are given an end-of-life irreversible situation, and you have a person identified to be your advocate for these decisions. Vice versa, the medical durable power of attorney form can stand alone, and you can provide your healthcare agent any instructions you would like. It does not have to be in the form of a living will document. You can write a letter. You can have great conversation. Just be sure that your agent is someone who knows you well and will honor your choices, no matter what they are. A little living will humor for you. We've got a couple sitting down watching TV, and one says, "Just so you know, I never want to live in a vegetative state dependent on some machine. If that ever happens, just unplug me, okay?" And the other person says, "Okay." My goodness, this agent surely listened to what their partner had to say. However, they may have been a bit hasty and maybe not applying the instruction to the scenario that was maybe most appropriate. Anyway, just an idea of how this conversation come about at any time when you're watching TV, just with a person who's willing to listen. And great example of a healthcare agent who is willing to follow. Just may need a little more clarification. So one way of completing advanced directives is through the 5 wishes. The 5 wishes has both medical durable power of attorney and living will components, and it's pretty well written in everyday language, and it helps people express both their personal and spiritual care wishes and helps describe what good care means to the patient. It works best when someone has gone through and filled it out very thoroughly, maybe circles and highlights what matters to them and maybe crosses out what doesn't matter or doesn't apply. And someone has gone through to write in more information throughout this document. If one chooses to use the 5 wishes as their advance directive documents, it would require their signature as well as 2 witnesses to be valid in Colorado. And there is room for the notary, which, as we discussed earlier, gives the document the most portability possible. So along with the planning that we can do before we pass away, it's important to also address what to do after we pass away. With that, we can make burial and donation plans. There's a very simple form available called the Colorado Declaration of Disposition of Last Remains that you could choose to complete and include as part of your advanced care plans. This form would not commit you to any funeral home or service, but it would let your loved ones know what your preferences would be for a traditional funeral versus a memorial or celebration of life, and also your choice of burial versus cremation. So all of that can be made known through this document or spoken to your healthcare agent, and they can arrange for whatever preferences you have. You can also choose to prepay for any funeral plans that you would like to make. That would really set into motion what you want and have it pre-planned, which can be helpful. It's also important to know a little bit more about organ and tissue donation. Those were some specific questions from this class, and it's pretty fascinating that there's hardly anything that can prevent you from being an organ or tissue donor. So if that's important to you, know that it's still acceptable given a variety of illnesses and ages. It's pretty amazing. You can learn more at Donor Alliance or donatelifecolorado.org. That is where you can check the registry for your donation. It's likely that when you went to the DMV to become a driver, they had you make a choice for organ and tissue donation. So if your license has the little heart at the bottom of it, that means you are a registered organ and tissue donor. Know that you can limit what's donated by going to their website and maybe making choices as to what you are okay with donating. Pretty great that you have that freedom, and wonderful that that choice is all yours to make. So know that you have options as to what can be donated. Also know that your loved ones should be able to say their goodbyes if that's important to you. You will need to make that known through your living will or give an instruction to your decision maker. because this process can go pretty quickly. Once it's clear that the patient is passing away, then whether or not you have chosen to be a donor, they will involve Donate Life Colorado. If you are passing away on a ventilator, you are requiring mechanical means for life, that does, and you want to be an organ donor, that does set you up well for organ donation. That harvesting has to happen right away as a person is passing away. And so to be an organ donor, it's pretty specific how you have to be passing away. When it comes to tissue donation, it's a little more open. They have more time to recover that tissue, and you don't have to be dying on machines. So it's a little more open for tissue donation, which is kind of fascinating. So let your healthcare agent know your preference for organ donation, and they will help guide that process. Helps to have an advocate, even though you can make your choices well ahead of time and have that documented. Also know that after the harvesting of organs and/or tissues, you can still have a viewing at your funeral. If that is important to you, that is still possible. It is done in such a respectful way that that is still very available to you. So I would recommend double checking the registry and making a choice that's right for you, and know that what's on the registry is what will be followed, and your agent should be brought in to whatever decision is right for you when it comes to organ and tissue donation. Amazing that one donation can impact many lives. So it's great that we have this option. There are also many companies available for brain donation and body donation. So here I have shared some resources. If that is of interest to you, know that these are great choices if it's important that you make a donation after you have passed. But do check with each company that you are interested in if you can still be an organ and tissue donor and provide your body or brain donation. Each company has its own set of rules for what's accepted and what's not, so it's important to align your choices so that you can accomplish whatever your preference is for burial and donation. Moving on now to some documents that are not done as far in advance of needing them. CPR directive is an example of a physician's order for no CPR, no cardiopulmonary resuscitation. So this is a way of respecting someone's goals for care that do not include going through chest compressions, electric shock, breathing tubes. All of that can be quite invasive, and considering someone's health before going through a process like that and what their health picture could look like after is very important to do and to assess, especially as illness and age become factors. So this form is signed by your doctor and you, the patient, or by your healthcare agent at a time that is determined well ahead of time as to when this is appropriate to seek. This form is valid whether you are out in the community or within a hospital setting. Know that a DNR, do not resuscitate order, is different. That DNR comes with an expiration date and is only valid for the duration of a hospital or healthcare facility visit. So if one's wish is not to be resuscitated, a CPR directive is a good way to accomplish that. And once this document is complete, it needs to be very available. Copies should go with the patient at all times. Healthcare agents should have copies of this form in case it's needed. And one can purchase jewelry that confirms that this document exists. You can have a necklace or a bracelet that says no CPR. So once this form is signed, it is active and it works like a prescription for no CPR from the moment it is signed forward. Along the lines of limiting care from the moment of an emergency forward, the MOST form is available. Colorado is a MOST state. That stands for Medical Orders for Scope of Treatment. This form is really intended for those who are in and out of the hospital a lot, chronically ill, medically frail, patients who want to have less aggressive medical treatment from the moment this form is signed forward. So there is a section on CPR. That is part A, and in addition to addressing CPR, there's also the chance to limit medical interventions such as intubation and going to the ICU at all. And then finally, there is a section dedicated to artificially administered nutrition. So whether or not that's appropriate at all for a patient, or whether that if the patient would like to try for a limited amount of time, that can all be documented through the MOST form. This is something that can be completed by the patient themselves or by the healthcare agent at an appropriate time previously discussed. This form does require the signature of a medical professional, though it is open to a physician, a physician's aide, nurse practitioner, so it doesn't have to be a medical doctor. Once this form is signed, it's important to post the original on the refrigerator for emergency responders to find. That is where they are trained to look for medical information within the home. And then copies need to go everywhere with the patient. And once again, you may choose to order jewelry, bracelet or necklace to say no CPR if someone has the MOST form. So this advanced care planning is an ongoing process, and I like to remember the 6 Ds when considering when to update information or at least review your documents. Perhaps you reach a new decade in age. What has happened in 10 years that maybe needs to be reflected in your advanced directives? Perhaps you experience the death of a loved one. How has that formed your opinions and choices? Perhaps there is a divorce, although Colorado law does not allow that ex-spouse to be a decision maker unless advance directive documents are completed again after that divorce goes through, and maybe you choose your ex-spouse again for this role. I've seen it, it's rare, but know that that process is in place through the state. You are given a diagnosis of a significant medical condition, or there is decline in your medical condition or functioning. That's especially an important time to be sure you have all your ducks in a row, have all these documents completed, maybe even consider a CPR directive or a MOST form. And sixth, departing to another state or country. If you are moving, it's important to do what's right for where you are living. Colorado is very accepting of out-of-state documents, but I cannot say the same for all 50 states or other countries. So important to ask the local hospital what the advance directive protocol is and what's acceptable. So updating forms can be done pretty simply anytime just by completing new documents and being sure to file those in all the same places that you did when you first completed your documents. It's appropriate to share with local hospitals, especially anyone named on medical durable power of attorney, and any physicians or doctors that you work with outside of the hospital system that you may choose to share with. Know that there is free personalized assistance available to you through the Aspen Club. While our membership is for those age 50 and forward, we will help anyone of any age to complete advance directives. It is just that important, and we provide a free service to do this. We want to make it easy and just as streamlined as possible. By appointment, we will provide witnesses and notary to you, answer any questions you have, and be sure to share your documents with the local hospital so that those forms are on file should they be needed. Please reach out if you would like to get your advance directives done, and know that we are here to support you. And here we have resources that have informed my discussion today and are of great quality and available to you if you are looking to dive deeper into this advanced care planning. All of these sites have quality information and more documents available, just a wealth of information available to you. And specifically for the MOST form, you will want to visit coloradoadvanceddirectives.com. That is the home for the MOST form and all of its information for the state of Colorado. I hope you now feel empowered to make a plan for yourself. It can sure give you peace of mind to have a plan for yourself, and a great gift to your loved ones to know what matters to you and what's expected of them if there's ever a time when you cannot speak for yourself. And with that, that's a wrap. Thank you.